Hello and welcome back to the Modern Mumma. Today I have with me Amee. Amee is somebody I have known since she was a child, but now she is a mother of a 2-year-old, and we're going to have a chat about pregnancy, motherhood, childhood, growing up, and yeah. So welcome, Amee, to the Modern Mumma.
Thank you, Pappy. Thank you for having me on. I'm really excited to be here.
Yeah, so we're sort of related by marriage, but yeah, I've seen you grow up, right?
You have.
So so tell me a little bit about yourself, or tell the audience a little bit about yourself.
I'm a mother of a 2-year-old. She's a little girl. Her name's Shakti. She's a very chatty, very intelligent little girl. I've been now married for 4 years, and we had Shakti very soon into our married life, and she's brought us lots of joy and happiness. My background is I am one of four children myself, so I'm the third girl out of four children, and I've got two older sisters and a younger brother, and we're quite a traditional Indian family. And in terms of my professional background, I am a nurse and a midwife by background, so very much in touch with, I guess, the maternal world, but from a professional background as well as having gone through it myself now. So I guess that's just a little snapshot of me. And
Yes, that is an absolute snapshot of you, but there's more to you than that. So you are number three in your family, aren't you? And then there's your younger brother. That's right. So you did mention you're quite a traditional family. So you grew up in a very extended family with grandparents, parents, uncles, aunts, everybody around you, and your grandparents actually lived with you. Um, how was that growing up?
um, I mean, we didn't know any different really. It was the norm for us. We were eight people in at the time when I was born. We were living in a four-bedroom house, but there was eight of us, so it was a lot of room sharing and a lot of things going on as a family. So there was always, when we were quite religious and cultural, there was a lot of things happening on a religious front where we were very involved in the community because of my dad. But growing up as a child in a big family, we had a very, very strong foundation. Not only did we have our parents, but we had our grandparents who lived with us, and they taught us so many things about religion, culture. Um, and yeah, so it really built a very strong foundation growing up, living in a joint family, the values, and everything associated with that, really. And as I said, we didn't really know any different, so we didn't know the other side, I guess, when not living in a big family. But it was pretty amazing. We learned lots of things.
Yes, yeah, and it was always a busy household. I think when I sort of I sort of knew you before marriage, but when I came in through marriage, I think you were living in Wandsworth above a shop, and your parents worked downstairs in the post office, and yeah, they worked downstairs. You were all upstairs, being taken care of by your grandparents. But there was all, like you say, there was always something going on. It was a different era almost, wasn't it?
It was. I mean,
Was it coming?
we grew up in an environment where, it wasn't set bedtimes, it wasn't set routines. We as children were very flexible around that busyness,
Mm,
and it
yes.
didn't it didn't necessarily impact our growth or our function, but it was pretty amazing because there was always something happening. There was always people around. We grew up in a hubbub of a community and of family, be that extended or people we just came across in day-to-day life. And once we were back from school, there was always somebody over, or there was always cooking happening, or there was always an event to prepare for. So we grew up around that.
But funny you should say that about no fixed bedtimes, because I know at times when we would be round and it would be like 10, 11 o'clock, and I'd be going, I think we need to go home. These kids need to get to bed. And this was before I had my own children. And your mum would be going, no, it's fine. It's fine. I'm like, no, they've got school in the morning. It can't possibly be up at this hour. But like you say, it didn't impact you. That was life, and you didn't know any different. So if we fast forward to, yeah, you've been married 4 years now. Before we go into your motherhood, your profession, nurse, and then you trained to be. Did you train to be a general nurse, or did you specialize?
So I trained to be a general nurse, and I did that for around 7 years. And then I went on to do a postgraduate diploma in midwifery because I felt like a change, and midwifery was always something I wanted to do. So I just delayed it a little bit with my nursing career, but went on to become a midwife and was doing that full time up until, gosh, 3 years ago. So being from a medical field and working around maternity and mothers was just something so rewarding and
Hmm.
very different from
Well,
nursing.
just being a nurse. I mean, my background is being a pediatric nurse, which I have left the profession a long time ago. But it takes a certain type of person to be a nurse, I think, no matter what speciality you're in, and that instinct of caring, compassion, it's got to come from within for you to be that. And then, like you say, being a midwife is bringing lives into this world, you know. Um, so as a midwife, um, and let's look at it from the midwife point of view, not the ummy point of view. You were trying for a child, or you decided you were going to have wanting children. How was that with all the knowledge that you have?
I think when you're a midwife, you see it from one point of view where you're on the other end, you're delivering the babies. You're very, very aware of the complications, the things that
Mm,
could go wrong, the things that might not necessarily go wrong, but you're very aware of sort of the risks associated with having a baby, conception, the risks associated through pregnancy, underlying health conditions, and it's very different when you don't have children of your own, because a lot of fellow midwife colleagues will be able to dawn on their experiences and say, well, when it was me, how I went through it, what my experiences were, and you're aware of the pain or the stress that the body goes through to be able to grow a child and actually deliver. And when you don't have a child and you're in the profession, you're very good at what you do because we are professionals, we're trained to be, and then you have that nurturing and caring instinct within as a person. But you've not been through it. You've not grown a child, you've
no.
not delivered. So it's it's different to say I understand what you're going through and and to actually understand what that person is going through. So I think as a midwife, when I was going through sort of the preconception, trying for a baby, I was very aware that things could go wrong or what I was putting myself in for, the whole pregnancy, the way the body changes, and then the end goal of going through labor and having a healthy child. And
Yes.
that in itself is an added pressure, I think. Being a professional, you're so aware and so alert that adds to the strain of, oh my God, we want a child and what's going to happen next, I think.
Yeah. Yeah. It's the knowledge you have, isn't it? And like you say, as a professional, you know all the things that can go right, that can go wrong. And it's, yeah, the pressure. So how did you feel when you fell pregnant? I mean, how did you feel? What were your emotions at the time?
So, I mean, initially, we weren't really expecting to fall pregnant as quickly as we did,
Hmm.
but we did, and we were both very, very excited. And to be fair, I mean, I was hoping for a happy, healthy pregnancy, and unfortunately, I did have quite a few complications through my pregnancy, so I wasn't able to enjoy it as much as I probably would have liked to. And on the other scale, as a health professional, I think we always downplay a lot of our symptoms, or we try and sort of
Mm,
discourage ourselves from seeking medical advice because we think, oh, maybe we're just making a big deal out of it, or maybe we're sort of playing up symptoms because we don't, I guess we're harsher on ourselves as healthcare professionals. So I think I was so excited, and then when I had so many complications, I think I was already feeling quite guilty. And I think for me, the mum guilt that people talk about fell into place quite quickly and in during my pregnancy. And I was very much aware of the complications. And I did take that on as a personal hit that I'm from a professional background and I was expecting everything to, be smooth and be great. And even though I was aware of what could go wrong, and all the
Mm.
complications, I wasn't prepared within myself. I almost felt like my body was failing me a little bit. And
Do you mind talking about the struggles that you had in your pregnancy?
yes, of course. So I had a lot of initially I started off with a lot of early pregnancy bleeding, which was like the spotting. And initially
Yeah.
we all know that that can be normal, or we're told that it's normal, and as a midwife I knew that. But that for me continued throughout my pregnancy. So I had a lot of scares where I was back and forth from the pregnancy unit and having a lot of scans, and they were saying there's nothing we can see that's wrong, but there was obviously
Mm.
this bleeding which was on your it plays on your mind, throughout.
Of
You're
course it
worried
does.
for the
Yeah.
safety of your child. And then I had something called hyperemesis, so I was completely nauseous and vomiting throughout my pregnancy. People had cravings
Okay.
on one side, and I was just throwing up. And so
Oh,
it kind of fell hand
that
in
takes it
hand.
out of you.
Exactly. I
Yeah.
wasn't able to enjoy it as such. And towards the end of the pregnancy, I then got SPD, which is the girdle pain. So I had a crutch and I wasn't able to walk properly because baby was quite big and pressing on the nerves. And it was quite a journey. It was
Oh,
challenging for
yeah.
me to have to walk around with a crutch and trying to explain to everybody that I was struggling with pelvic pain. And I guess while people don't judge you, and while people don't look upon you and think that you're not doing a good job, you feel that as a mum or a soon to be mum, that your body's not quite doing its job correctly. So I did feel like my body was failing me through my pregnancy quite a bit. And if I put my midwife hat on, I know that I would be telling my ladies, or my patients, by saying that you shouldn't feel that way, and it's the body's just naturally growing a human being, and that takes a lot of energy and it puts a lot of strain on the
Mm.
female body. But I think at that point
But
in
you
my
weren't able to tell
pregnancy,
yourself. The
I wasn't
midwife wasn't
able
able to
to.
tell Amee.
Exactly, I wasn't able to educate myself or to reassure myself through my journey that it's okay, this is normal and it can happen. So those I
If
think
you
those are
were
the
to
challenges.
if you were to give advice now of those things, is there anything that you could have done to have prevented this, any of the complications, or is it just something natural that just happens and you were just unfortunately a little bit unlucky to have suffered these?
I th- I think definitely. I mean, very very soon after Shakti was born, I think I actually had people around me saying all these things to me, but I actually sat myself down and I reflected and I said to myself, look, that we as healthcare professionals know that there are some things that are not in your power, they're not in your control. And these things,
Hmm.
when it comes to pregnancy, no matter how healthy you might be preconception, if it's going to happen, it's going to happen. It is pot of luck. And if you are unlucky to have these things, you will come out of it stronger. It's not something you've done. It's not something that's in your control or in your power. Unfortunately, it's just sometimes when you grow a human being, when you put that much energy and effort into growing a human, that it does put a strain on your body. And not everybody has a smooth pregnancy where everything's normal and it's all going to have
Mm.
no complications and a positive outcome. And I knew all of that. It was just about trying to regain that confidence in myself and in my own body, and
Yes.
in that. So it's hard to teach yourself that when you're having two caps on, not just a midwife, I'm not just a nurse, I'm now going
Mm.
to be a mum. And it's trying to then decipher what's okay to do as a mum and what's not okay, and trying to
Yeah. Well,
separate the
it's no
roles.
mean feat. It's no mean feat, like you say, growing a human being inside you and giving birth. It's, but coming to the end of your pregnancy and the birth, how did that go?
So I was induced towards the end of my pregnancy because I had something called reduced fetal movements, where baby wasn't moving as much as its normal pattern to do so. So because I had had a few episodes of that, the midwives and the doctors decided that I was quite close to the end of my pregnancy. I was 39 weeks, so I wasn't that far off
Right.
the 40 weeks. And so they said, well, let's induce you. And I said, well, if that's what's recommended, I'm not going to play the professional here. If that's what you feel is best, then
Mm.
that's what we'll
Yes.
go for. Um, in the end, I think I was induced over a period of 3 or 4 days, where they tried various methods, and it was okay to start with, I'd say. It was a standard induction of
Yeah.
labor. I was in hospital. I had my husband with me. I had my eldest sister with me. And initially it was all fun and games. We were keeping each other entertained, and then things started to kick off. And I was moved on to the labor ward, and I had my waters broken, and contractions were coming, but perhaps not as strong as they needed to. So I was given a drip to get my contractions going. And
Hmm.
I decided that I didn't initially want to have an epidural, so I was having the hormone drip, but with no epidural, and I was using gas and air for pain relief, and I was managing quite well. So this is probably about day 4 into the induction process. So I'd been on the ward quite some time, and I was now downstairs laboring. So obviously quite tired already, but was trying to
Yes.
regain sources of energy and trying to keep upbeat. And I think I was in a period of about 15 to 18 hours where they were examining every 4 hours. I was having the drip, still no epidurals, just on the gas and air. And I got stuck at 6 centimeters dilated. So the cervix had only dilated up to 6 centimeters, and I'd been like that now for 8 to 10 hours. And I was getting quite tired, and I was getting quite not septic, but my temperature was rising. So at
Mm.
which point, they were a little concerned that the cervix wasn't dilating anymore. I wasn't progressing, and at which point I was tired, and I'd requested an epidural, and whatever was going on at the ward, it was busy, and they couldn't
Mm.
offer me that straight away. And I think at that point I did feel a little bit disheartened, and I felt like I wasn't coping very well. And then that's where my sister and my husband sort of jumped in and said, look, she's usually very good at coping with pain, and if she's saying she's
Yes.
not coping, we need to do something. So in the end, I succumbed to an epidural. We had that sited, and I was still only 6 centimeters, by which point I was borderline having a temperature. My observations weren't very good. And I sort of sat down with the doctors, and I said, look, I don't think I'm progressing. And if I put my midwifery cap on, I'm a little bit concerned that I'm still stuck at 6 centimeters. And when you examine me, you're saying you're not able to feel the baby's head, so the baby's still quite high up.
Mm.
And looking at the overall picture, it doesn't seem like this is heading in the direction of a normal delivery or even a bit of help. At which point, and again, this is a perception thing. This is my perception of what was going on through my labor. But the doctors came down quite harshly on me by saying, well, a cesarean section isn't something which is a maternal request. And I was quite taken aback by that, because I felt that they weren't looking at me as a pregnant woman in labor. They were looking at me
Mm.
as the midwife in the bed who was trying to advise them how to do their job, which I wasn't. I think I was just trying to say that, we both know that this isn't really advancing to a normal delivery, and I don't want to stress out my baby any more than it is showing signs of distress.
But
Um,
the fact that you were a professional midwife, they should have. I feel they should have considered that maybe, and
and
that
I
you
think
where you were coming from.
I agree. So looking back now, I did at that time feel like they made me feel, now this is how I was feeling, but they made me feel self-conscious and bad for being a midwife and telling them my concerns, as opposed to
Mm.
hearing my concerns as a mother, or from a mother's point of
And
view.
they're very good at doing that.
I agree.
Medical
So
professions can be very good at doing that to you.
in that moment, I don't think I felt heard or understood, and I was very, very low at that point, where I was just like, well,
Mm.
this isn't right, you know. And
Well, you're
they wanted
worrying about your baby, obviously, the safety of your baby.
exactly. So they wanted to wait another 4 hours, and I said, well, I'm not waiting more than 2 hours. And do you really think after that 2 hours I'm going to be fully dilated and pushing? And they agreed that I wouldn't be. And so then they decided to go ahead, and then I had an emergency cesarean section um, on the fifth day of induction. So I was in there for quite some time. But Shakti was born. She was happy. She was healthy. She was holding onto her cord for dear life, which was around her neck twice.
Oh
But
God.
that would have explained why she was so stuck and why she was distressed. But
But they
she,
had not identified that,
no, they hadn't.
the fact that
And
the cord was.
no, and when I come back to that day, even now, the doctors didn't come back to, I guess, debrief me as to what they found when they did my cesarean section. which I thought was probably not the best practice on their behalf, because as medical professionals we always go back to debrief after an emergency situation or a situation like that, where we say, well, yes, we did the cesarean section and this is what we found. And I never had that kind of closure from them. They never came back to me and said to me, well, yes, the cord was around the baby's neck, we were right to make that decision. It was almost like they were too proud to come back to me to say that. And
Mm.
I had to figure it out myself, almost asking the questions and asking the midwives around me, which wasn't a positive
Now,
experience for me.
no, but the fact that you were in the profession and you had all that knowledge. Now, if that was somebody, I say a layperson who had no knowledge of what was going on, um, I think it would be quite frightening. You were obviously worried about what was going on, but you knew what was going on, literally. Whereas for somebody who's not in the profession, has no idea, that can be quite scary. You
100%.
know,
And the fact that I'd seen it so many times before as a midwife,
mm,
and as
yes,
midwives we do play advocates for our ladies. We're fighting for
of
them through
course you
thick
do.
and thin, and we are their voice.
Yeah,
And that's the
yes.
time it made me realize that it was unfair that I was being treated differently.
Mm, absolutely. I mean, not to name any hospitals or people. Did you give birth in the same hospital that you were working in?
So yes, I gave birth in the same hospital that I used to work in. So I'd actually stopped
Used to
working
work in,
there.
yeah.
Stopped working there, I think, just before I conceived, actually. So before I got pregnant, I'd
Oh,
actually job
okay.
changed by then. So
Right.
it's not like they didn't know me, which
Mm. Yeah, that's
or
why I'm
know.
asking the question. You would have known the people then if you had worked in that unit. Was that the unit you were working in?
Definitely, yeah. So I worked around the whole unit, so I was very well known, and my aftercare was brilliant. They really looked after me after I had my baby. It's just during my labor, and unfortunately, during your labor, it is very doctor led if you're on the labor ward. So the doctors rotate; they don't know you, but the midwifery staff do. So they obviously
Yeah.
have that battle between them as well to try and provide the best quality care.
But how did you find the midwives, the care from the midwives during your labour?
To be honest, I can't fault them at all. They were amazing, and they
Mm.
tried to fight my corner with me, and they were really reassuring, and they were able to see the red signs that I could see when I was looking at the trace for the baby, for example, or how I was going through what I was going through. So
Yeah.
they knew that I wasn't just a hypochondriac or a midwife who was trying to tell them what to do. That they knew that I had been quite laid back up until that point, where I thought, okay, now I need to say something because I can hear the
Yeah.
alarm bells ringing, and am I being heard? So they were phenomenal. Like, I can't doubt them at all.
But it's just unfortunate that some medical professionals feel that they don't like you said, you weren't telling them they have to do their job, but they just feel like they don't want to take advice or anybody else's opinions, which is a real shame because you would think you being having been a midwife and practiced, they would take some heed of that. But Shakti was born and she was healthy. That's the main thing.
Yes, and that was the best outcome I could have had. The right decision was made at the right time, as far as I was concerned. It doesn't matter how I got there. We had that positive outcome.
Yeah, having and I know in the past when I've spoken to people, or it used to be a big thing, and I don't know if it still is. I mean, you'll correct me on this if I'm wrong, but people would make birth plans. Everybody has to go in with a birth plan, didn't they? And then sometimes if your birth plan didn't go to plan, oh my God, it was really not a good outcome, or women would get very upset by it or say that it had all gone wrong for them, and it hadn't been the experience they wanted, etc. Did you have a birthing plan ready? And obviously it may not have gone to plan, but did you have something in place that you wanted?
I didn't, to be honest, because I was considered high risk because I had some underlying health conditions anyway. So I always knew that if I was to
Right.
deliver it, it'd be on a labor ward. But it's like I always tell my women that A birth plan is an idea. It's a rough guideline as to what you would like, but please don't think that
Mm.
that's what's going to happen, because 9 out of 10 times the baby has a different idea altogether, and depending on the
Yeah.
circumstances at the time, whilst you might want all these things which are great, what will be offered to you is what's safest for you and your baby at that moment in that time. And
Mm.
I'd had a discussion with my husband to say, well, these are the things I will be okay with. These are the things I won't be okay with. Just to give a rough guideline. It wasn't sort of set in stone. And we'd had a discussion about sort of, because he's from a non-medical background, I'd already discussed with him what could
Yeah.
go wrong and at what point I'd need him to advocate for me. And I'd already spoken to my elder sister about that as well. And the reason I had her there is because she'd had two high risk pregnancies herself, and she was very alert,
Yes.
alert and aware of what to do. So we never had a set in stone plan, but we'd always had that discussion quite openly as to what we'd all be comfortable with, or when it wasn't okay, and when I'd need them to step
Yeah.
in. But I think we have to be realistic as women that we might plan one thing, but it doesn't always go to plan, and we have to be open to that through
Yeah.
your pregnancy.
Well, that's like life, really, isn't it? We have many plans and ideas, and life doesn't always go like that. But yeah, um, but how were you after? Obviously, you'd had a cesarean, but your underlying health issues. Did they correct themselves? You know, did it all go okay after that?
I think my recovery did take a lot longer because of my pelvic pain. That kind of didn't leave me for at least, I think, 2-3 months after I had Shakti. So initially, after you've had a cesarean section, it's a major surgery. So you're having to recover
Yes.
physically, and you've also got this newborn who is
Mm,
dependent on you. And I
that's
initially had
right.
to have my husband had to pass her to me a lot, and I wouldn't physically be able to take her out of the cart, or she was quite a heavy baby, so even carrying her for long amounts of time, it put a strain on my body. And I think for me, that's where this mum guilt as well sort of popped in and cropped its ugly head a little bit, where I felt very depleted, I think, and defeated that I wasn't able to cope with something which was supposed to be so natural for women, a childbirth. And here I was struggling to carry my baby, and that's the most unnatural thing for a newborn and a new mum. And I think I was pretty harsh on myself, in that situation, because my body wasn't quite caught up to being a new mum and ready to provide for my newborn. And
Mm,
it took time. I think healing does take time, but for me, it took that little bit of an extra time frame.
yeah. And were you able to breastfeed your newborn?
I was, thankfully. That in itself was an interesting story, and I feel like when I talk about it, it sounds like everything happened to me, but I've made peace with it. So Shakti was, bless her, initially when you had a cesarean, it takes time for your milk to come through. So by day 3, my milk
Right.
was starting to come through, but she'd lost weight, so we had to stay in hospital, and we did have to top her up with formula. And whilst I know breast is best and that's what we promote, I was, well and truly okay with it, because I knew that that's what she needed at the time. And I knew it
Mm,
wasn't going to be a
yeah.
long term thing, it was just to get her weight up. But initially, I think no one really tells you that breastfeeding is difficult. And I think that's really important to relay to new mums, that breastfeeding isn't as easy as your baby's just going to
Oh
find the
gosh, no.
breast and you're going to feed, and it's going to be an absolutely amazing journey. And everyone has
Oh
this
no, it's
idea,
not.
everyone has this
I
idea that, it's going to be amazing and it's going to be really easy, but it really isn't, because you're getting used to handling a newborn. Your breasts haven't done it
mm,
before. Your hands haven't done it before, where you're actually latching a child onto your breasts. So it is a challenge, and I was all ready for it because I'd had all the training in the world, and I knew there was
mm,
something wrong with Shakti in with her feeding, and I was doing everything right. My positioning was great. My latch was great. She was latching on, but I was in pain. And I was telling the midwives and the health visitors around me that there's something wrong. Because I'd go from feeding, anywhere between 4 hours in one sitting to up to 10 hours where she'd just be on and off the breast. And I'd be like, this is just not normal. Like, there is no way that this child is that hungry, but not putting on that much weight, even though I've got a good flow.
mm,
So, I persevered for 4 weeks with the whole cracked nipples, the bleeding, the
Oh,
the
oh
pain,
dear.
everything. And I thought,
Yeah, yeah.
breast is best, and I'm going to do this. And then I was referred to a lactation consultant because I was saying something's wrong and no one was listening to me. So this lactation consultant nearby where I live was absolutely amazing. She said, should we try to get her to open her mouth? And before you know it, Shokti was yelling anyway, so she was ready for a feed, even though I just fed her. And she didn't even have to touch her. She just said, she's got a tongue tie. She's got a
I was
she's
going to
got
say,
she's got a tongue
yeah.
tie, she's got a lip tie, and she's got a very high palate. And she said to me, I am so surprised you're still breastfeeding because anybody else would have given up by now. And she said the combination of the three it's the triangle, it's lethal because they're unable to get enough breast in their mouth to be able to feed, and that's why she's just latching on the nipple and you're in pain. She goes, you need to give yourself a break, have a day off, and I'm going to refer you to have her reviewed by a tongue tie specialist to see if we can get it released. Are you planning to
Yeah.
continue? And I said, yes. So, I really want to breastfeed and I don't want to formula feed. But that night I went home and I had a little cry. And I said, thankfully, someone is listening to
But
me.
you
There is
knew it's a mother's instinct. It's a mother's
exactly.
instinct. And I don't understand why they don't listen to you.
I think on reflection, I think when
So
somebody
frustrating.
notices midwife or nurse on your paperwork, they're already so alert that
Yeah.
you might know better than them, or you might question them or challenge them. So their guard
Yeah.
goes up and they
Yeah.
don't listen. And
Oh,
this health visitor, she was amazing. She referred us. Shakti had her tongue tie released at 5 weeks. And I'm not joking, that first week after her tongue tie was released, she put on 750 grams. And I was the happiest woman on the planet. It was the
oh.
weight gain and the journey from then. Her feeding was amazing. And then no
So
top
you said
ups, nothing at all.
she had a tongue tie, a high lip, did you say?
So she had a posterior tongue tie, which is quite a tight
Mm-hmm.
tongue tie, which is right at the back of the tongue
Yeah.
underneath. She had a lip tie, which is,
A
where your
lip tie.
front gum is, just at the top. There's a little bit of
Oh
skin
yeah.
there as well. She had quite a tight
Yeah.
lip tie, which was meaning she couldn't open her mouth very, very
Yeah.
wide. And with the tongue tie, it didn't help. And she also had a high palate where the inside of the mouth, the bit where we can touch our tongue to the roof of
Yeah.
the mouth,
Yeah.
was very, very high. So as the breast was hitting
Okay.
or going into her mouth, she wasn't able to quite push her tongue high enough for the nipple to reach the roof of the mouth because the roof of the mouth was too high. The tongue was too
Right.
tight and her mouth wouldn't open because her lip tie was really tight. So it was a very lethal combination where she wasn't
Oh,
effectively feeding. And they tell you that when that's the combination, she has pain on feeding, and so do you. So it was breaking my heart that she was in pain and I was in pain. And what was
yeah.
supposed to be another pleasant experience actually became painful. But we came out of it,
Mm.
and she was thriving by the time we released her
Did
tongue
she
tie.
have the? So it's just the tongue tie that had to be released. What about the lip tie? Does it? Do they
They
do
don't
anything with
do
that?
that. No, you can do it sort of privately, under
Hmm.
cosmetic reasons if you choose to, but the NHS don't do that in the UK. Actually, they don't release
Right.
lip ties. They sort of not resolve on their own, but when children grow up, when they fall or when they knock themselves, that usually, as graphic as it sounds, would tear itself and then just not heal again. It's just one of those things that may stay intact or may through injury go away on its own. So we didn't have that
Okay.
changed.
Yes. Right. So 5 weeks on, you've now sorted out these things. Was life getting better for you? Was motherhood? You were in a better place as sort of caring for your baby yourself mentally and physically. You were still obviously in pain from your cesarean, but mentally, because you've been through a hell of a lot during your pregnancy. You've had 5 weeks of this, nobody listening to you. How did things go after that? And
I
what
think
sort of space were you in after that?
from a feeding point of view, it was brilliant. I was able to provide for her, and in your
Hmm.
mind, when your emotions are running wild, that's one of the biggest concerns I had, was I wasn't able to provide for my child. I wasn't able to
Yeah.
make her thrive. And for me, as soon as the breastfeeding kind of fixed itself and we were able to do that, that was one sort of tick in my box to say, you're doing your job as a mum, you're able to feed your baby. For me, emotionally, I didn't connect with Shakti until she was probably about 8 or 9 weeks, because the trauma of labor, then the trauma of
Mm.
breastfeeding, I was very disconnected from her. And I acknowledged it, but I hid it very well from the healthcare professionals around me, because I knew what to say. Um, in that
Yes.
sense, you don't want to come across as the one who's going through the blues, or who's going through a little bit of borderline postnatal depression. It wasn't something that you take pride in, I think, and especially coming from quite an Asian background, it's just not something that's discussed or you're allowed to feel. You had a baby, you should be happy about it. What are you so upset about?
Yeah.
You know, and
And also the health professions, the minute they pick up on it, you'll be referred left, right, and centre again, won't you? Because I remember with my second child, I was feeling a bit down actually. There'd been lots going on at home and family, etc. I'd been quite ill during that pregnancy, and after I had him, they'd keep asking me. It used to be the Glasgow scale. Is that what it still is?
yes,
Yeah.
it depends on the area, but yes, they still use it.
Yeah, I and she'd come round, the health visitor come round and sort of ask me, and I kind of knew, and I had to say to her, look, I've got a lot going on, but I am not on this scale, okay? I sort of had it because, like you say, as a healthcare profession, you know where they're going with it. You know, I said I know exactly what's happening to me. I am in control, and I am not going down this scale, so don't worry about it. But yeah, and like you say, what in well 20 odd years ago, postnatal depression in our community was not even heard of, or what is going on, there's nothing wrong with you. You're right. It's a real taboo, and I guess it still must be for the older generation. I don't know.
For for the
You would be
people
a better judge
around
of telling
me,
me that.
I mean, I mean, my in-laws are still very quite traditional and quite cultured, and are they are of the older generation, a bit like my mum, my grandparents
Mm,
and extended family. And being a woman of today, I think we're a little bit more aware that it's okay to feel that way. But I think when you're a mum in that situation, you don't want to be judged, because you feel that your every move and your every step is being judged anyway. Your every parenting is being judged. You feel
yeah.
that way as a new mum. And I think that whether it is or not, that notion is there in place already. You already know that there are people who are saying, oh, I didn't do it like that, or why don't you try this? And you're almost like, I don't want to try it like that. I want to do it this way. And there's all these judgments being passed anyway, that if you then turn around and say, I'm not okay, that everyone's just going to step in and say, well, why aren't you okay? And then she's over exaggerating. I got the whole she's fussy. um she doesn't take our help, so how can we help her? And it's comments like this which you might not think anything of when you're not a new mum, but you're already emotional, you're sensitive, and you hear these things and you're building up this mum guilt. It's just building up, and you're just thinking, I'm not doing a great job at this. Why did I put myself through this? And why did I do it? And you deserve better. I remember looking at Shakti and saying, you deserve better than this. And and that's not true. I mean, I've said it to so many mums that you are the best.
Mm,
You are the best mum that baby can have, because you are its mum, and not anything
yeah.
anyone says or does is going to change that. And what you decide is always going to be the best for your child until it's 18 and tells you otherwise. But you know,
Yeah.
you are its mum. And I think for that first
So how
eight
did you
weeks,
cope with that? Yeah. How did you cope in those first 8 weeks, like
I didn't really
yourself?
tell anyone about it. I didn't talk about it. I didn't tell my
Not
husband.
even
I
your
don't think,
sisters?
not even my
Your
sisters
sister, your
initially. No, nobody. And it was always because in my family, because I'm the healthcare professional, I was always perceived as I'm the strong one. And that image
mm,
in
yeah.
itself, then having a newborn and being a mum and saying, hi guys, I'm not coping or I'm struggling, I couldn't say those words. It just they wouldn't leave my mouth. And my mum could see through me. She said, she'd pulled my husband aside and said, look, I'm really worried about Amee's mental health. She seems very low and it's not like her. And I'm concerned. And he said, yeah, she's tired. She's not been sleeping well. And it was a conversation between them, which I had overheard anyway. Um, and I think at 8 weeks, I'd sort of said to myself, enough is enough. and this isn't healthy. Like, I look at my child and
Mm.
I know she's mine, but I don't feel she's mine, and that's not a healthy way to nurture and grow a baby to be a healthy individual themselves. And I think that's when I reached out to my sisters, who were phenomenal, and one of my really close friends sort of checked in on me regularly, and I sort of sat down and said, I'm not okay, and
Mm.
I just don't feel happy, and just think I'm tired, and it's been a rough journey, and I haven't quite come to terms with that journey yet. I was just given
Yeah.
this baby in my arms after my cesarean section and said, well, there you go, this is your baby. And funnily enough, I remember saying to my sister, I said, the first thought I had is, how do I know that's my baby? I mean, I didn't witness it come out of my body, And she said, don't be silly. Of course it's your baby. Who else's baby is it going to be? And I said, it's not, I know it doesn't make sense. And nothing about how I was feeling in that moment made any sense to me. And that scared me. And I said, I know
Mm.
she's my baby, and I don't understand why I feel this way, but that's how disconnected I felt. Didn't feel like she was mine. And then at 8 weeks, she smiled at me. We were feeding, and I said to her, I said something quite frank, and I'm very random that way. With Shakti, I always talked to her like she was a mini adult, even when she was a baby. I was just like, right, so
Yeah.
Mummy's going to feed you now, and then if she gets a minute, she might even try to feed herself. And she just started laughing, like she just giggled at me. And in that moment, I think I'll never forget that was the moment I was like, she's mine. Like, and it was this overwhelming emotion. And it just kind of hit home that this child is mine. I grew her and she came out of me. But it sounds funny now talking about it. But in that moment, I literally thought I was losing my mind. And I knew all the skills as a healthcare professional, as a midwife. I knew what was going on with me. But to register it and link
That's the
it,
scariest part as well. That's the scary part as well, isn't it? Knowing that, but not being able to do anything about it. And I think we are our own worst enemy with the knowledge that we have when we're healthcare professions. We don't, like you say, we don't help ourselves. We are the worst at that. So at 8 weeks, you you got a smile, which is great.
yes,
And
it
how
was
did that make you feel?
pretty amazing. And I think at that point, it kind of came home to me that I'm a mum, and it was, I don't know if it was
Yeah.
hormones or it was the actual connection or the bond, but I had a little weep, and I think, as you do, for the first 8 weeks, all I felt like I did was weep. But
Of
this was a
course.
different kind of a sob, and there was no looking back. We were best friends from that moment on. Every day was better. It got more and more positive. She was thriving. I felt like more than just a mum to her. It was an
Yeah.
amazing connection, which I was gutted at. I had missed out on those 8 weeks of that connection, but there was no turning back after that. It was just amazing.
Hmm. So having had her, and traditionally, um, in our culture, we tend to, after we've had our baby, go and sort of convalesce with our mothers. Our mothers take care of us, and we go to our mother's home. Did you have that opportunity, or did your mother come to you, or did you, was it rotation of mother and mother-in-law?
So
How did it
my
work for you?
we had decided that I was going to come home because my husband had 2 weeks off, and
Right.
we really wanted to connect as a family initially. So
Hmm.
unfortunately, because of the complications, we were in hospital for the first week, and then the following
Right.
week, my mother-in-law came and stayed with us, um, to
Hmm.
look after me and the baby. And I mean, initially I would have gone to my mum's, but because we'd already come home and we were settling into routine, we didn't. But my mum would come round to see me. Um,
She was just around the corner, isn't she?
yeah, she's
So
not too
she
far, so
wasn't that
she
far
would
from
pop
you.
in. Yeah,
Yeah.
she would pop in to see us, and that was only really for the first 2 weeks of Shakti's life. And then my mother-in-law went back. She's in Leicester, so she went back to Leicester. And mum had to attend a family wedding in the US. So Shakti was 2 weeks, and it was just me and Shakti at home. So I think that's why a lot of these things went undetected. It was because it was just the two of us. Like, my husband would be back at work, and he'd come home at 6, and I'd be sat in
Yeah.
the same position, still feeding. And he'd be like, well, have you eaten anything? And I'd be like, I haven't had a chance. So bless him, in the mornings, he'd make a sandwich and leave it by my bed and say, look, just in case you can't get to the kitchen. And I think things spiraled out more because it was just the two of us, I think, initially for the first 8 weeks of her life. But
Mm.
after which I went to stay at my mum's for a week, and I think replenished my energy and my resources, and it was lovely.
Yes. Yeah. And you know, at the beginning, we talked about you growing up in an extended family, and you're very much, I guess, a nuclear family now. And like you said, those things going undetected because when you're in that extended family, it can have its good points and bad points because there could be so much going on that you do feel overwhelmed. Um, but you bringing up Shakti is well, one, it's a very different era to when you were brought up, and you're not in this huge family environment. Yes, they're all there, they're all extended and they're there, but day to day, it's you, your husband, and Shakti. How is that for you? Because like you've said, the way you were brought up is very different.
I think whilst we're in the new sort of we're of this generation, and we're in I guess that parenting era of where routine is important. We know that now, where timings are important, routine is really important for the child's health. I think I still find that this new age parenting can be quite isolating, because I grew
Mm,
up in a family where there was hubbub and there was help and there were aunts, there were uncles, there were people around. It wasn't just my
yes.
mum and dad and us. And even when it was, if my mum and dad and us, if my grandparents were away or if people weren't coming around, as siblings, we had enough of us to keep us going. Where it is just now, Rahul, me, and Shakti, I think we look at things and we think, things become quite repetitive. The routine is pretty standard, particularly with COVID at the moment. We weren't able to sort of go out and explore family and things. But I think it's a shame that, like, my child won't have the same kind of closeness to their extended family as we did, because we grew up knowing and understanding the value of family and the importance of it, and we could see what it brought to children's lives as well as the adults' lives. That
Yes.
it was a learning journey for everybody. You learn from generations above about religion, culture, and the way of life, and as children they learned from us because we were fresh to the world. The way we learned things, the things that we saw with our eyes and how we portrayed it to them, they were able to learn new things from us. Whereas I think for Shakti, bless her, I think she won't get the same, I guess, level of input from extended family, where I can only teach her so much about our religion, our culture, or
Mm,
the way of life, because I can only teach her the knowledge I have. Whereas if we lived in a joint family, for example, with my in-laws, or even if it was my mum or my grandparents, even now, um, they would have different opinions and different teachings and a different approach, which Shakti won't get because we live away from family or we don't live with them, which I think is a shame, I think.
yeah, and your sisters have both got daughters, so there's what she's got five cousins, isn't she?
So she's got five
Two,
cousins
two of your older sister
on
and three.
yeah, on my side, so from my mum, like from my sisters,
Yes.
and she's
Yeah.
got three cousins from her dad's side. Um, but unfortunately,
Right.
they don't live close either. So she
Mm,
gets interaction once in a while with them on occasion, or if we travel to see them. It's not too far, but
yes.
it's still very isolating. The only interaction she gets with other children is at nursery, really, um, and through friends circle. But that's not the same as family, you know.
No, no, but I think this generation, it is more about the friends and, like you say, the socializing from school or nursery and your parent friends that you've made along the way. Whereas I know when I was growing up, I mean, yes, I had friends at school, but outside of that, it was my cousins. They were my friends, and they were my family. We didn't need anybody else. And I've seen the same with my children. I mean, they're now in their 20s, but it's been very much about your friends are your family, not your
Yes,
family are your friends. You know,
definitely, and I think
um,
we were that generation of the cusp of that, where we still had some friends at school and some friends in the community, but predominantly our cousins were the people that we grew up with. We met up at every function, every,
Yep.
every
Weekend.
celebration, every other weekend, school holidays, half terms, where,
Yeah.
whereby we were just at that level as well. But now it is literally the family that we have now with the friends that we've chosen, and on occasion, unfortunately, the family that we're related to is when we engage with or interact with them.
Mm. Your husband, was his upbringing very similar to yours, or was it different? I know you said he's not from London.
He had a very, I mean, I would say he had a similar sort of upbringing to me. As I said, my in-laws are quite traditional and quite cultural, and he actually lived with his grandparents as well. So whilst he had a lot of
Right.
aunts and uncles, his grandparents lived with him. So he did live in a joint family up until
Mm.
I think the age of 8, 9. He had sort of uncles and aunts living with him, but then he went on to having his grandparents living with him until they passed on. So he is from a very similar background, and he's a lot more quieter than me. So I think he found friends in his siblings and had his friends, and they had cousins that they all sort of grew up together. But it was different from his perspective, because he was from a family of just three brothers, whereas we were a household of three girls and I had a little
More
brother. So
girls.
we had a
Yes.
lot more sort of excitement
The
and
dynamics.
loudness.
Dynamics are totally
And the
different, aren't
dynamics were
they?
different. Definitely,
Yes.
definitely.
Yeah. And now all of you have got daughters.
Yeah, so
The
my
girl
sisters
gang
and
again.
I is we've got a girl gang. We've got now hold on, let me get this right now. So there's six
Six of
girls
you.
between three
Six.
of us, and
Yeah.
they
Yeah.
are definitely the life and soul of any party. They are
I
phenomenal
bet they
girls.
are. Yeah. And how your parenting, compared to how you were brought up, or how your parents parented, is that are you is that a combination of yours and your hubby's upbringing together, of how you're bringing up Shakti?
Um, I think yes and no. In terms of culture, respect for elders, respect for each other, things that we learned, that's very much the foundation of our
Mm.
parenting. But I think as new parents and parents of this era, we have tried to bring about what's healthy as well, um, in the sense
Hmm.
that things with routine, what we eat, how we behave. So, health and fitness, promoting that in parenting and being a parent, just trying to say this is important, this is healthy. No, you can't have certain foods, or to make sort of healthier lifestyle choices. Sleep is important. You need to get enough sleep.
Yes.
Downtime is important. Whilst it's important to meet people and have a good time, it's important to understand the importance of calming down, having moments to yourself, and emotional empathy. Being able to acknowledge my emotions, and getting Shakti to learn how to acknowledge her own emotions, and to know that it's okay to be upset or to be distressed. Or, when we were younger, it was very much like, you know, stop crying. Why are you crying? Or why are you so upset? Or
Or
it
it was
was,
one
yeah, it was one
tap.
of those that, just get over it. Whereas I want
Hmm.
Shakti to be able to understand and acknowledge her emotions and be able to articulate that I'm not okay. From a young age, she's able to now recognize that I'm not happy, I'm sad, and then I'll say to her, okay, that's okay. Would you like a cuddle? And if she does, she gets one. And if she doesn't, I'll say to her, would you like to calm down in the corner? And she says yes or no. We'll walk over to the corner, she calms down, and she's able to acknowledge that, yes, she was distressed, and that's okay. And that she's got an area in the house where she can go to calm down and gather her thoughts if she wants to. And we sit down there and we'll do Om Namah Shivaya about 3 or 4 times. She calms down, and then she's able to tell me, this is what upset me. And she's only 2, but we try and work on that sort of emotional empathy, understanding, routine, health, because whilst we had some of that growing up, it wasn't sort of the
It wasn't as
priority.
vocal, and
It wasn't as
no, it
vocal. And
definitely wasn't.
I think that impacts you growing up, where the mental health is a taboo. I want her to embrace that if she's not okay, she can tell us, and we'll figure it out together, and that it's okay to not be okay. So I think that's where it's different
Yeah.
from how we were raised. Not saying that we were raised in a bad way. It was just a different way.
Well, it was circumstances. I mean, I'm in awe of your mum and always have been in awe of your mum. She's a super woman, as I say, you know. If you think about everything that she juggled, you know, we don't do any of that. You know, she ran a post office. She looked after her in-laws. She had 4 children. She was an amazing and is an amazing cook, and would have food just there all the time. You know, she was with there in the community, keeping all the relationships. I mean, what a juggling act that is that your
And
mum was doing in
I mean,
those days.
definitely. And I always put my hand on my heart and I say, she set the bar very high for me and my sisters. When we look back at
Yes,
parenting, she did it all. She set the prime example of what a perfect woman should be. And she never once said to us it was easy. And she never once lied and said that, it's going to be easy. But she did it flawlessly. It was, she
with a
knew what,
smile on her face
with a smile on
always.
her face, no matter whether she was happy, sad, or if circumstances
Yeah,
weren't great. She did it completely effortlessly. She made it look like it was no effort at all. And for me, that she will always be that role model. And I know for my sisters as well that
yes.
they look on her to see what she went through day to day to have us initially, as well as to raise us. 3 girls and a boy. It
Mm,
wasn't easy. It isn't easy now, and
no,
it definitely
no.
wasn't easy then. And whilst the times were different, I know that when I talk to my mum about parenting and how we do things now, she often sits back and she says that, perhaps I wasn't such a great mum to you because of everything else that was going on in life. And we always say to her, no, because you were an amazing mum and you are an amazing mum. You set the foundations for us to be strong, independent women. And we've learned so much from you. And it's not that what we're doing is better than what you did. It's just different. It's learning from what you did and
Yeah,
being able to grow and provide a slightly different upbringing for our children, keeping the foundations that you set for us. And that's often something
yes.
we talk about.
Mm. I know. I mean, my mother-in-law was much older than your mum, much older generation. But you know, she used to, as you know, she used to live with me, and she'd look at us running round, around after our kids and taking them here, there, and everywhere. And she'd often say, in those days we had very little, but we were so happy with what we had and what we did with our children. And now you guys have so much, but you don't have the time. You are just, in a rat race, and you guys don't stop. Because you can see that she's sitting there on the sofa watching us, and it's come home, it's doing the homework, it's doing this. I mean, I'm sure they never once sat down with their children to see them doing their homework. um, but yeah, it's really interesting, isn't it, how the generations have changed, but there are still elements there that you pull the threads through and you take with you in your own parenting. And yes, your mum is an absolute role model, till this day, I would say. That she can sit back and reap the rewards of the foundations that she's laid. You know, so as we come towards the end of this podcast, I always ask the 3 golden nuggets of what you would say to, I think in your case, a mum to be, a mum going through pregnancy, and a mum who's had the child. Can you give me one of each and make that 3?
Oh, um, okay. So somebody who's gone through,
Conception. Let's look. Hmm.
um, keep an open mind, I would say, and don't be
Hmm.
too harsh on yourself. The body will do what the
Yeah.
body is meant to do, and allow it to do that, and accept whatever comes along the way. I would say for
Yeah.
conception. um, Pregnancy, I would say,
I
again,
know, I know yours wasn't the best of experiences, but anything that you learned from your experience.
it is an amazing experience. You know, you will have hurdles and obstacles along the way, but the outcome, the end goal is phenomenal and it's life changing in a good way. So, if anyone is ever in the position that I was in and it's difficult, just know that there is light at the end of that tunnel, and it's a bright light, and it's something to keep you going. So, to try and keep a positive, upbeat, open mind. But if you are down, it's okay to not be okay, and reach out to people around you.
Mm.
And
And once you've had the baby,
once I've had the
once
baby,
you become the mother, once you become the mother,
there will always be
a
hurdles.
mother,
There will always be hurdles,
yeah, oh yes.
always be challenges, and it's just a chapter in her book and in your book. So I would just say enjoy every moment. Time passes so quickly, time flies, and they flourish and they thrive before your eyes. I would also say mum guilt is there, but don't let it consume you, because everybody around you
Mm.
is probably going through exactly the same things that you are going through: concerns, situations, upset, turmoil. People just don't talk about it. Nobody will say to you
That's
that
right.
I've had a really bad day, or I'm feeling really bad, or I feel like a bad mum. People will only show you the positives, but that doesn't mean that behind closed doors and inside their heart, they're not feeling the same way. So don't let mum guilt consume you, and just enjoy every moment, because before you know it, they're two. And then I'm sure before I know it, she'll be 20. And she might be having this conversation with somebody else on another day.
Yeah. Well, I had a friend who said to me, when they're little, there are little problems. When they're older, there are big problems,
A
you know,
100%,
and challenges.
definitely.
But I haven't even met Shakti yet, and I really look forward to meeting her
Let's
at
do
some
that
point.
soon.
2021, let's make it our goal by the end of 2021. I know we're in two different countries, but once we're back in the same country, we've definitely got to do that. And it's been a real honor speaking with you today, because I've seen you grow up, Amee, since you were, well, I think you were born when I came into the family, but you were very little, and you were one determined little girl who has now turned into an amazing wife and mother, and also very determined, I think, still to say. And it's just been amazing speaking to you tonight. And thank you so much for doing this. And
I am honored that you asked me. I'm really, really honored, and the pleasure is all mine. It's been phenomenal. So thank you very, very much.
no, and thank you for everything, and opening, speaking openly and honestly, because I think it's very much needed for mothers to be mothers who are going through things, when they hear it, that it's okay to be okay. And everybody is saying that out there, but our community and our culture doesn't always allow that. And I think it's really nice speaking with you, somebody from an Asian background, to say that, who's also a midwife. And just wishing you all the best on your journey of motherhood. And I look forward to watching your journey and of Shakti growing up. So thank you so much.
Thank you,
Take
Heather.
care.
You
Thank
too.
you.
Thank you. Bye.